Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer,
The dental hygienist,
from Bulgaria,
Buffalo, New York,
Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers,
8 Lumineers,
10 Lumineers,
6 Lumineers,
10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
and now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. Good morning, everyone. I'd like to welcome you to a demonstration of the placement of Lumineers. They're all no prep cases. What we do is we do cosmetic contouring. And so you want to think about cosmetically contouring the teeth. And I did that with our patient today. She has a porcelain crown on her maxillary left central. And you'll see the gingival margin in a moment. You have a lot of those patients in your practice. Now, in this case, I did remove some tooth structure, didn't I? Yes. And our patient, Diane, came in. Did I give you any anesthetic for removing that tooth structure? Do we have a picture of what her teeth look like before there? That's what her teeth look like before I did cosmetic contouring. So, when I give you the close-up in here, you'll see that I shaved off the mesiolabial of the right lateral, and I shortened the central on the left central, and then you're looking at that gingival margin up there, and I'll show you how to take care of that. And we also shaved off a little bit on the labial of the right central, and a little bit on the labial of the, what was it? I think it was on your left lateral. And then we did a little modifying on the cuspids, but it was all in enamel. Now, it's very important that you realize I'm working with 4-power magnification. And if you're not working with 4-power magnification, these procedures are somewhat, I wouldn't say difficult, but it'll be much harder for you to avoid the sensitive tooth structure. So I always work with 4-power magnification, and this enables me to create feather edges during finishing. Now, I'd like to show the tray setup to you. This is what Jessica has prepared. These are the Lumineers. Now, Lumineers are different than traditional veneers because they're pieces of porcelain that just don't look like that you're getting a perfect marginal fit. So how do you get the perfect marginal fit? You get the perfect marginal fit with the Ultrabond. And so that's what we put between the porcelain and the tooth. That's very critical. And then she has already treated these porcelains with 2 solutions. She's treated them with the Serenade Prime, and she's treated it with the porcelain conditioner. Porcelain conditioner goes on first. It's an organic acid, citric acid. And that's important that you put these 2 steps on when you're bonding to porcelain. Conditioner first. That porcelain conditioner activates the Serenade Prime. That means that the silane is going to be at its peak when you apply it. We started with an impression material. We got a good impression. We use Lumineer impression material because it's a 2-phase system and allows you to get feather edge margins, and they're just really perfect. We're going to get started now. Before we really get started here with Diane, Jessica's already polished her teeth, and we polished it with the porcelain polishing paste. We don't use pumice. Pumice really doesn't remove anything. It just gives you a good feeling, because if you look at pumice, it just pushes stuff around. So we want to have the porcelain polishing paste. It's the same material we use for restoring a polish on the glazed surface. But we do that before we start because it gets rid of all the interproximal plaque, and we don't want any of that around if we're going to get chemical bond. So the first thing we're going to do is we're going to micro etch the porcelain. And then we're going to put some Porcelain on it. And before we apply the Porcelain, I'm going to show you how to create a small trough between the porcelain and the Dentin. And I want that small trough to be made with the smallest round diamond I can find. This is where magnification is critical. So I want to get in here and get behind the tooth and get behind the porcelain. And this would be almost impossible if you didn't have 4 power. Now the critical part of this is to get the metal so it doesn't show and get slightly under that porcelain. And this was a good margin. The dentist did a nice job for her, even though it was painful. What I'm doing is putting a little paint on dental dam on the gingival interproximal margins. And we're going to use the sapphire light about an inch from the surface. Close your eyes. And in a moment, I'll show you what we've been doing with the paint on dental dam. Close your eyes. Close your eyes. Okay, now let's take a look. Can you see that all right in there now? All those embrasures are filled with blue paint on dental dam. That's partially set, and that keeps the ultra bond from getting into those interproximal embrasures on the lingual and greatly simplifies finishing. An Explorer, please. I just want to test this for set. Now we've micro-etched the left central. We've created a trough between the porcelain and the gum line. And then we have put on the paint on dental dam. Could I have a brush, please? I'm using Porcelain here because it's safe to use in the mouth and it's buffered. Okay. Now, while that's etching the porcelain, and the question is, hydrofluoric? Porcelain is the safest hydrofluoric acid you can use. And it's buffered, but I don't give copious amounts of that. For example, if you get a little phosphoric acid in the mouth, it's no big thing. So if you notice, I was very discriminating in how I applied that to the tooth. Did you notice that? It has medium viscosity, and so it's a safe material to use, but I'd be careful with it. That's the best way I can place it. Now what I just did is put the porcelain conditioner on the surface of the porcelain. Now I'm going to apply etch and seal to the natural teeth. And we're going to go from the first bicuspid to the cuspid. And you'll notice I'm putting a little dab on every tooth. It's medium viscosity. The reason that I use etch and seal is because it contains aluminum oxalate to seal the dental tubules. And once again, I just use a brush to push it around on the surface of the teeth. Now we've applied an inorganic acid to the natural teeth. That's the phosphoric acid with the aluminum oxalate. And let's see, put a little bit more on this one here. We're going to wash these off. And I already washed off the porcelain first. Okay. And this is Serenade Prime that we're going to apply to the porcelain. So remember, 2 solutions to the porcelain and 2 solutions after etching on the porcelain. We did actually 3 if you take the porcelain in there. Now we've applied that to the surface of the porcelain. Now we're going back to natural tooth structure. Now if you've never done this before, you say, gee, these are a lot of things to remember, but they really aren't. And I like tenure A and B because it doesn't require a light to make it active. We want the surfaces clean and dry. Now we're going to check for shade. And this is what shade? And this is the try-in paste, right? B0. Okay. And let's try another shade over here on the... I'll just do it on the right lateral, not the central, because I want to keep that space open. And you see the excess everywhere. And what shade is this? This is B1. Now you get a chance to see these. And now we'll let the patient select the shade. You like this one? Or do you like this one? A little too white for you on that one? Mm-hmm. Right. Something a little less white. Now what I would like to have the left central with nothing on it so I can show the audience what happens if you try to do try-ins with air behind it. And the problem you run into on that is that you're getting the reflection back from the etched surface of the porcelain. So we always want to do try-in paste, and the reason we want to use the Ultrabond try-in paste is because look how dark that root was, and you don't see it there. Now, if I were to use a clear material on there and not obscure that, then this dark shade would come through here. Now I'm using the non-setting resin to remove the various try-in materials. Now we're going to put tenure S on here in a little bit. And tenure S is designed to do 2 things: protect the surface from contamination, and it also will activate any unremoved try-in paste. And I don't like to use the aqueous systems that are out there. And I need some tetrapaque enamel. And I need just a little bit of that right here. Now push this around. A Dentin shade in there. I just want to put just a little bit of Dentin shade there. Okay. Okay. And this you want to put on. Okay. And we'll start applying the Lumineers. Tooth. Right central. Brush. And then the laterals next. Left lateral. Okay. And I'll take the right lateral next. Okay. It's the right lateral. You just tap these around very gently. I'm going to brush some of this off. And give me the 2 millimeter tip for 1 second. Okay. I'm going to give 1 second exposure. Don't move. Be very still. Close your eyes. Okay. And close your eyes. Okay, I want to get these two set. And this right central is just a little longer. We'll be able to modify that after we get them set. Which side? Left cuspid. Okay. And the reason I wanted to spot those two in first, I'm not trying to get everything finished, just getting most of it out of the way. We're taking the 2 millimeter tip. Close your eyes. In the middle, 2 millimeter tip. And I always stay away at least one tooth. Close your eyes. You notice when I put the two centrals on and I did the lateral that I didn't do the 1 second spot on the lateral because I wanted to stay one tooth away from anything that I've set in place. Right cuspid. You just sort of tap these into place, let them flow, they'll find their way. Right first bicuspid. You see why it's so important to have everything ready ahead of time, because this is not the time to ask for something. There you go, close your eyes. Closing your eyes is the best protection. What I do is I look at how I've got it set, and then I tell the patient, close your eyes. And I use my other hand to get a very stationary finger rest. And we'll put one last one on here. Close your eyes. Okay, we're off the runway. We're in the air. The only thing we have yet to do is get the wheels up. So we're going to take a brush here and remove some of the excess. And this is tenure S on here. What I'm doing now is removing the unset material. I don't like to use that technique where you wave everything and get it all partially set and then carve it away, because sometimes your margins open. And this way, margins never open because it's still quite fluid. And I want to make sure that as I drag it away, I'm taking the Ultrabond and having it fill in the space between the porcelain and the tooth. Now, if you think about what we're trying to accomplish, we're trying to accomplish a stress-resistant, non-micro-leaking aesthetic result. And if you think about what Ultrabond Plus is, it's a restorative material. Now, just before I set everything, I'll give you a quick look at what we've placed. And already you can see there's a significant transformation in her appearance. And then we've got the blue back there, so no Ultrabond can get in there. And now we're going to take a 5-second spot on each tooth. Close your eyes. Now, if we don't get the light on Ultrabond, it will polymerize in about 10 minutes on its own. If we didn't get all of the tri-in paste out, the Tenure S will polymerize the Ultrabond tri-in paste. Guys. And one more. Now think about what we've just accomplished with that sapphire light. In less than 1 minute, we polymerized all these materials, placed 8 Lumineers, and all we have to do now is finish. I'm just checking to see if there's any significant amounts of unset material on the back, because the sapphire does a pretty good job of getting through it. So we're going to start taking off the paint on dental dam. See if we can get that picture in there and you can see it hanging down. I'm using a Sure 349 instrument. See how that just lifts off? Okay. Let's take a look at something else here. I want to direct your attention to the thickness of the incisal edge on the porcelain crown. If you look in the, see how much thicker that is? That's how we brought that out than the right central. And we'll just now take this fused mass of material, and I want you to think about what I just said, that fused mass of material. We have fused porcelain, restorative, and tooth all together. So what I'm going to do is remove the excess with the Sure 349. And you want to use this. It's an orthodontic band seating instrument. And it won't scratch the glazed porcelain. If you use your hygienist scaling instrument, it will scratch the glazed surface. And I don't know if you can tell, but we've pretty well masked and obscured that gingival margin. We do this routinely with individual crowns and other parts of the mouth. We shorten the porcelain crown, and we created a little trough, and we put the tetrapaque Dentin shade in there, and we didn't set it, and then we just placed it over that, and then obscures that margin. But now all you have to do is open the contacts and take off the excess, and many of you could use a really highly qualified RDA or a dental hygienist to remove the glaze like this. All these instruments are in the Lumineers finishing kit. So now I'm using a football-shaped diamond here. See that right there? And I'm blending the porcelain, the tooth, and the Ultrabond restorative all together. Okay. Now I'm going to use an ultrafine diamond here, and with magnification, I just go up inside these embrasures. And I'm staying on the edge of the surface, and I'm removing the ultrabond first, and I get right next to the gingiva, but with 4-power magnification, it won't cause any bleeding. Okay, now it's beginning to take shape. Now what we're going to do is take off as much of the ultrabond as we can between the teeth. I used to try to get it all off and get everything finished on my placement visit. Now we're going to take the needle nose diamond and open the interproximal embrasures and remove the shoulder. Think about it. If we haven't created a shoulder when we prep the tooth to have the porcelain go in there, then we've created one, and we don't want to have that happen. We never retract tissue, and we want to have the porcelain stop at the gingival margin. Now I'm opening the embrasures. And I stay away from the glazed labial surface. Something else I don't like to do is open the interproximal contacts and you can modify and contour these after you bonded it, because then they're very secured and very resistant to fracturing. Now we go on the lingual side and open these embrasures. It's very important that before you try to open the contacts, that you remove almost all of the ultrabond. Now it's just a matter of finishing and I'm going to take a 12 fluted burr here. I like to use the fluted burrs, and it's the only time I use a burr on the marginal areas. See if you can get that in there just a little bit. I can put a little pressure on there and not affect the and there'll be some ultrabond left on the lingual side, and we'll do some polishing today. Okay. Now close. See how it's coming together now? Can everybody see that all right? Okay. Grind your teeth. Yes, open? Okay, open. And there's a little bit more on the lingual side we want to take out. Open. What I'm doing right now is just removing any excess ultrabond. And I want to get in these embrasures right in here. Right. See how we removed almost all the ultrabond from the interproximal embrasures? Check the occlusion. Now when I go with the seri saw, there won't be much to remove. So it'll slide through the contact relatively simply. This is a seri saw. As I said, all these things are in the Lumineers finishing kit. And I just start pulling through it like this. And it's like taking a test. You do the easy ones first. And I don't get them all open. Now, the one I'm not going to open today is the one on the porcelain crown. Never open your contacts and put high pressure when you're doing a porcelain to porcelain bonding. You can get by with it, but I've had some where I used force. Something else I'd like to do, did you notice I quit sawing? And then after that, I start rocking it back in like this. See how we're rocking? And then that keeps it from slipping and cutting the interproximal interdental papilla. See how I'm just rocking in there? Okay. Okay, now we've gotten those contacts relatively open. We're going to use a thing called a seri sander. And it's a safe-sided diamond finishing strip. And we just go back in and get those areas smoothed a little bit. And once again, I do the easy ones. And the other ones, believe it or not, will be easy when she comes back, because all of those contacts will start breaking loose on their own just with normal mobility of the teeth. All right? And I tell patients that you won't be able to floss that well. Not to be alarmed about it, because we'll get them all open. But I'll open this one here. It's relatively easy. See how I'm going back and forth so much? And I'm just checking all these margins. And I'm leaving this shoulder in place on the porcelain, over the porcelain. But notice how that obscures that. Let's do a flashback if you can. See how that was? Now let's go back. We do this routinely. And you can do this routinely. I mean, if you can put solutions on the surface, gently put it to place, and then take off the excess, you can be a whiz. We're going to take off the excess and check the occlusion one last time. Then we'll take a look at the patient. Close. Gently grind your teeth around. Open. How does your bite feel when you put your teeth together? Feels what? Feels good? Okay. Open. Well, we're getting marks on all the posterior teeth. And when she goes into lateral excursions, we'll take a look at that. It's very important that you get the occlusion adjusted just right. Close. Grind your teeth around sideways and forward. Open. Open. And that's fine. So, I guess it's time for the patient to get a chance to look at her new smile. Take a look. You like it? You want to keep it? Yeah, they're really nice, aren't they?